2020. We appreciate your participation and patience with this technology. Recording of this meeting will be posted to our website after the meeting. Public comment. There will be multiple opportunities throughout this meeting for public comment. When I open up an item for public comment, please use the raised hand function to indicate that you would like to make a public comment on this item. If you're joining the webinar on your computer, you can do so by clicking the raised hand button on the middle bottom of the Zoom webinar window. If you're joining over the phone, you can do so by pressing *9. PCTPA staff will then call out individuals who've raised their hand, giving them permission to speak one by one. When you're called, please state your full name and city of residence. You'll then have a maximum of 3 minutes to provide your public comment, and PCTPA staff will notify you when your 3 minutes are up. If you experience technical difficulties and are unable to provide your public comment, please email your comments to Sophie Sobel, our clerk at ssabol@pctpa.net. Board actions. Because this meeting is being conducted via teleconference, all votes will be roll call votes. Board members, we ask that you state your name prior to making a motion or a second for the record. Once an item has been moved and seconded, I'll ask the clerk to do a roll call vote. Thank you very much. And I hope you'll bear with us. This is the first time we've come back into chambers doing this as a bit of a hybrid meeting. So there may be some confusion as we work our way through that today. Hopefully not. If you'll all please now stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. So Lisa, roll call, please.
Amara.
Present.
Baker. Broadway.
Here.
Burris.
Present.
Holmes.
Here.
Howdesheld.
Present.
Joyner.
Here.
Jones. Wilkins.
Present.
All right, and we do have a quorum. With that, we'll move on to approval of the action minutes. Anyone have any changes to make to the action minutes? If not, I'll accept a
Motion to approve the action minutes. Director Burris.
Director Broadway. All right, I got the motion Burris and Broadway second, I believe. Sophie.
Amara.
Yes.
Baker.
Aye.
Broadway.
Yes.
Burris.
Aye.
Holmes.
Aye.
Howdesheld.
Aye.
Joyner.
Aye.
Jones. Wilkins.
Yes.
All right, thank you all. Motion passes. Agenda review is up next. Any requested changes to the agenda? None from staff? We'll just go ahead and move forward then. I don't think we need to take an action on that. Next up, item E, public comment. Any members of the public wishing to comment on an item not on the agenda? This would be the time for that. Do we have any members of the public wishing to comment on an item not on today's agenda? I'll give it a minute.
As a reminder for those attending via Zoom, if you would like to comment, please hit the raise hand button at the bottom of your screen, or you can press *9. Mr. Chair, I'm not seeing any hands being raised.
All right, thank you very much. In that case, we'll go ahead and move on to item F, the consent calendar for Placer County Transportation Planning Agency. Does any member of the board wish to pull an item from the consent agenda? Any members of the public wishing to pull an item for discussion? Seeing none, we'll go ahead and I'll accept a motion on the consent calendar.
Howdesheld moves.
Broadway is second.
I have a motion and a second. Sylvia, roll call, please.
Amara.
Yes.
Baker.
Aye.
Broadway.
Yes.
Burris.
Aye.
Holmes. Howdesheld.
Aye.
Joyner.
Yes.
Jones. Wilkins.
Yes.
Motion passes.
Motion passes unanimously. We'll move on to item G, consent calendar for Western Placer Consolidated Transportation Services Agency. Again, any member of the board wish to pull an item for discussion? Any member of the public wish to pull an item for discussion?
Mr. Chair, I'm not seeing any raised hands at this time.
All right. So I can look up here and hopefully see raised hands. Because that one's not going to work for me. My eyes are too old for that. All right, in that case, I will go ahead and accept a motion on the consent calendar for Western Placer Consolidated Transportation Services.
Broadway move approval.
Seconds. I have a motion and a second. Sophie, roll call, please.
Amara,
Yes.
Baker, Broadway,
Yes.
Burris.
Aye.
Holmes, Howdeshelt,
Yes.
Joyner,
Yes.
Wilkins.
Yes.
Motion passes unanimously.
Moving on to item H, I'm sorry, consent calendar, Placer County Airport Land Use Commission. Same process.
First motion approval.
All right,
Amara second.
I have a motion and a second. I do want to give everyone a chance if they want to discuss the item.
No.
Seeing none, any member of the public wish to discuss this item? I don't see any raised hands. So motion and a second, roll call, please.
Amara,
Yes.
Baker, Broadway,
Yes.
Burris.
Aye.
Holmes, Howdeshelt,
Aye.
Joyner,
Yes,
Wilkins.
Yes.
Motion passes unanimously.
thank you. We move on to item I, public hearing, non-emergency medical transportation services. Ms. Handler.
Good morning. Thank you so much, Chair Joyner. Today before you for consideration is a public hearing regarding Western Placer Consolidated Transportation Services Agency's non-emergency medical transportation programs. As some background, Western Placer Consolidated Transportation Services Agency, or CTSA, as I will refer to it in this presentation, currently operates two non-emergency medical transportation programs. The first is called Health Express. Health Express is jointly operated by MV Transportation, Inc., a contractor, and Seniors First, a nonprofit organization. Health Express provides, as the name suggests, appointments for health appointments in the South Placer area. It does serve some of the unincorporated area, but mostly those that are roughly contiguous to the incorporated cities. The total cost of this program is about $750,000 a year. CTSA funds the vast majority of those, 92% of that cost, with the rest coming in with grants from the hospitals that Seniors First secures on behalf of CTSA. Over the last 5 fiscal years, ridership has of course fluctuated, particularly with the COVID-19 pandemic, but ridership is roughly about 5,500 trips per year, and the range is on the slide. Due to the high cost of this program, the actual cost per use is very high, costing about $121 per trip to provide this service, and that is about $108 per trip cost to CTSA. Ridership on Health Express over the last 5 years has declined pretty dramatically. Towards the back half of the graph, you can see the significant decline with the governor's first stay-at-home orders in spring of last calendar year. But overall, the trend fluctuates pretty dramatically, and we've been seeing very slow recovery on this service, even though stay-at-home orders have been lifted and have fluctuated over the last 18 months. The second non-emergency medical transportation program that CTSA operates is called My Rides. This is a volunteer-based transportation program wherein Seniors First works with local volunteers and residents of Placer County who need rides places and matches those volunteers and riders up to take trips in their own personal vehicles. And then CTSA pays on a per mileage basis for the cost of those volunteer trips to take place. This program is much more economical. Total cost is under $300,000 a year. CTSA still funds the majority of that cost, and there is some additional funding with hospital grants through Seniors First. And you'll notice that ridership is about the same over the last 5 fiscal years as the Health Express program. As a result of the dramatic difference in total cost, the cost per use is much smaller on rides, about $40 of total cost, and about half of that going to CTSA. However, the My Rides program's ridership has declined dramatically over the last 5 years, even before the COVID-19 pandemic started. A lot of this has to do with a mismatch between where volunteers are available and where passengers need rides. There are a lot of seniors aging in place in Placer County's unincorporated areas, and most of our volunteers are concentrated in our cities. So it's difficult for Seniors First staff to match up drivers and riders in the same location. In addition, Seniors First staff only has so much time to track down volunteers and track down riders, so the program hasn't been able to scale to meet the needs of Placer County's population, which has resulted in a decline, in addition to, of course, the COVID-19 pandemic over the last fiscal year. As a separate note, or related, CTSA's revenues over the past 5 to 10 years have outpaced our expenses. As a quick note, in fiscal year 2018, CTSA did not take its usual allocation from the local transportation fund, which is why you see that big dip in the revenue line, and was instead dispersed to the local jurisdictions. But the trend is that overall expenses, the blue line, has significantly outpaced the amount of revenues we have, with the largest gap happening in the last fiscal year with the loss in sales tax revenue as a result of the stay-at-home order. This means that CTSA's budget has had a significant reliance on carryover. That's the gray color in this chart. And with the decision to not remove any of this service during the COVID-19 pandemic, as we didn't know how it would really affect our residents, we chose to eat into that carryover in order to continue to operate service despite the loss in sales tax. So projecting forward over the next 5 years, you can see we have barely any carryover left. So we need to right size our programs to fit the revenue that we project moving forward. For the board's consideration earlier this year, staff suggested that we look at a program change of combining the two Health Express and My Rides programs into a new program called Placer Rides. This new program would continue to be a partnership with Seniors First, but would use a model that was developed by Independent Living Partnership, a nonprofit based in Riverside. The model is very similar to My Rides in that it uses individual volunteers to provide trips in their own personal vehicles and reimburses them on a per mile basis. The key difference is that instead of the nonprofit doing the matching, identifying the drivers, identifying the riders, and trying to co-locate them, the program empowers the individual riders to look for neighbors, members of their family, folks who go to their church, other people who have doctor's appointments in their neighborhood, to identify their own volunteers and sort of build in their own network to identify drivers. This helps with the geography problem that we have in Placer County. It helps with a lot of the isolation that we see in our senior population and in the COVID-19 recovery, as we're all trying to keep our bubbles close. It's really smart in that sense as well. This model has a long track record of success up and down the state and across the country. And Independent Living Partnership has worked with different nonprofits and different CTSAs similar to ours to develop these types of programs. As I mentioned, the key difference in these two programs is the rider role. Previously, the rider only had to register with Seniors First and then take the trip when the trip was scheduled for them. In the current Placer Rides model, they'll need to secure their own driver and build their support network. They'll be able to schedule their rides independently. Instead of having to rely on an intermediary of Seniors First staff to schedule their own rides, they'll be empowered to ask a ride from a member of their own community the same way that those of us who can afford our own transportation are able to do when we need rides. They'll take their trips at their own convenience, and then they'll just report those trips monthly to Seniors First for reimbursement. Seniors First role also changes dramatically in this process. Currently with the My Rides program, they need to register riders and drivers, do all the trip scheduling, report on the trips, do the reimbursement, submit all that information to CTSA for reimbursement on the mileage basis. In the Placer Rides program, they'll only have sort of the beginning and the end of this process. They'll register the riders to determine eligibility, and then they'll report trips and reimbursement and do oversight of the requests that come in from the riders. This freed up time for Seniors First staff gives them the ability to do the work that they're more suited to do, like handling special cases for folks who really don't have networks to identify volunteers. They'll be able to maintain a volunteer roster of individuals who say want to be a driver and want to donate their time, but don't know anyone who they might be able to donate a ride to. They'll be able to refer folks who they deal with to other services, because as we know, oftentimes when folks access some sort of public service, really what they need is a lot. And they'll be able to educate them on other transportation options. Maybe these folks could actually take Dial-A-Ride or the train, or Medi-Cal could pay for a trip for them. And Seniors First staff will be able to educate them with additional time. We'll also be able to serve a lot more residents with this service change. In our current program, we do about 100,000 annual miles of trips and about 100 unduplicated riders. This is of course not how many trips we do. A lot of our riders take multiple trips through the months and through the years. But we identify about 100 people are taking advantage of the current 2 programs of Health Express and MyRides. And the 2 programs, including staff time and overhead, cost about $1.3 million a year. With the proposed service, if we maxed it out with the current budget that's projected for next fiscal year of $500,000, we'd be able to provide 8 times the number of miles and help 3 times the number of riders. That number 3 times the number of riders assumes that they all max out their 200 miles per month budget, which many are unlikely to do. So we're likely to help far more than 300 unduplicated riders. For consideration with the board item today is the service policies for the new program. The service policies, in addition to outlining the roles and structure that I've already previously discussed, discuss eligibility. So riders will be limited currently to Placer County residents who are 60 plus, or individuals with disabilities, or low-income individuals. And they'll have to provide some anecdotal evidence of their inability to use public transit. Our current programs are pretty strict on physical eligibility to use public transit. You have to be outside of the service area of one of our dial-a-ride systems. Because of the subscription of our services, oftentimes, even though folks live within those areas, it's very difficult to make that trip, also very expensive for the taxpayer to make that trip. So we're going to try loosening up that restriction a little bit and allow them to provide more qualitative information as to why they can't make the public transit trip, in the hope that we can be able to provide these trips more effectively on a cost basis in the future. But I'm going to continue to monitor it with the operators to ensure it coexists well with our existing transit system. Trip eligibility is also going to be expanded. Currently, technically, it's only non-emergency medical trips. As nonprofit folks who we work with Seniors First, we've tended to have a pretty loose definition of what a non-emergency medical trip is, but we're going to formalize that in the new service policies and include essential errands like grocery shopping or correctional and rehabilitation appointments. Someone might have to have meetings with Social Security, other nonprofits, other type of social service appointments, and then also any transfers to public transit. So if someone needed to get downtown for a medical appointment, it might make the most sense for them to get a Placer Rides trip to Auburn-Conheim Station and then take regular bus down into town. The drivers will have no application. This is, I understand, strange in terms of its transition from the current MyRides program. But what we're saying is that individuals are capable of making the decision on who is a safe driver and who they trust to provide the trip. So Ctsa and Seniors First will remain at a distance, separated by the rider from the driver. In addition to saving paperwork, this also frees us up from liability. So because the rider is choosing their own driver and signing waivers to state that Ctsa and Seniors First are not held accountable for what happens on that individual passenger ride trip, it's really just a reimbursement program and a transportation assistance program. We're insulated from any of those liability issues. That also allows us to be a lot more free about what types of trips that we weren't able to previously provide on MyRides and Health Express, including allowing folks who have visual impairment or dementia or Alzheimer's, folks who get eye treatment appointments and are blinded for the temporary day. Previously, we couldn't provide trips to those folks because they technically weren't totally mobile. Now, at the driver's discretion, as long as the passenger and the driver agree upon the stasis in terms of service animals, wheelchairs, any of that kind of thing, those all are eligible trips under the new program. As I mentioned, trips will be limited to 200 miles per month. The software that we're going to use has an ability to do a case-by-case basis for exceptions. We are aware of a couple of current riders who live farther up the hill and have to go to, say, the VA hospital pretty regularly for appointments. It's not our intention to prevent anybody from being able to get to the medical appointments they need to get to. So we'll be able to adjust that cap on a case-by-case basis with staff decision. Setting the 200 miles per month limit helps us prevent fraud and helps us identify for years to come how we might want to expand the program due to demand. Currently, the average amount per month is about 44 miles per individual rider. So most folks are well within the cap. Origin and destination must originate, and the trip must originate in Placer County, and most trips must be fully within Placer County. As a note for the folks watching close, the Tahoe Basin is eligible for this program as the MyRides program was previously. Specific Sacramento County medical centers, as I mentioned, the VA hospital are eligible destinations, and those will be handled on sort of a case-by-case basis, although we do list in the service policies a list of example destinations. The program will also include what we're calling last resort trips. These will be evaluated on a case-by-case basis, and they're when no driver can be found and the trip purpose is absolutely essential. You have an appointment, you can't miss it. It's essential that it happened this week, and we can't find a driver for you, and you can't find a driver for yourself. In those cases, the Placer Rides program will cover the cost of a taxi, Uber, Lyft, or if needed, an ADA private transportation trip, if say the person was in a mobility device, in order to allow them to have that trip. Those trips will be limited to a maximum of 2 round trips per month. We really want to try to encourage folks to identify their own volunteer drivers and build a network of independence that way, but we want to account for when these emergencies come up as they do. Riders will report monthly on the origin, destination, and purpose of their trips. They'll be reimbursed per mile with the current fiscal year's IRS rate. Currently, it's about 56 cents a mile. Only the first 200 miles will be reimbursed unless they've been given a special case-by-case exception to the 200-mile limit. So even if they submit 250 miles of reimbursement, we're only going to reimburse them for the first 200 miles. The checks are written out to the rider, and the rider passes along the payment to the driver. This helps protect CTSA from any liability of consideration that the driver is an employee of CTSA or an employee of Seniors First. What we're doing is providing a transportation assistance program to the rider. So it's a social service for the rider, and they are using that benefit to be able to secure their own transportation. So the board considered this item as an information item in February. Over the last couple of months, I've been working on stakeholder outreach with our nonprofit partners and with developing the service policies that were under consideration today for the board in preparation for today's public hearing. A mailer notifying every existing MyRides and Health Express passenger and driver for MyRides went out in the mail, notifying them of this public hearing, explaining the service change. Seniors First staff in their information and assistance department, their call center, have been hard at work handling those calls, explaining to folks the transition, explaining to folks how to provide comment at today's public hearing if they so choose. Should the board choose to move forward today with this service change, the next steps between April and June would be to work on training Seniors First staff on the new program and how to get folks signed up, and then migrating as many current clients of Health Express and MyRide services who are interested in the new program over, and developing new agreements with Seniors First and Independent Living Partnership to accelerate the deployment, all of which will be for those new agreements will be for consideration for board approval in June. The aim is to start the new service July 1. However, I'm hoping to beta test with some of our more savvy riders in June who could test out some of the kinks of applying for reimbursement and working through the new application forms so that we can get some feedback before we launch it to all our folks. The long-term vision is once new service begins in summer 2021 for the next fiscal year, work on just getting the program, getting our feet under the new program and outreach to slowly grow the ridership within Placer County. Eventually, the goal of this program is that because it's so much more cost effective to be able to solve some of the transportation issues that we have seen in the county for a number of years, including the ability for folks to get to Nevada City and Washoe County if they live in the Tahoe Basin. Sometimes we see ourselves paying for these really long trips for folks to say go from North Auburn all the way down to Roseville when really the Grass Valley would solve their issues. And same for folks who live in, say, Tahoe City, they come all the way down to Davis when they could go to Reno because of the availability of service. So the idea is once we can get this program a little bit more autonomous and a lot less expensive, that we'd be able to pursue funding opportunities or maybe even have CTSA absorb those additional expenses within its budget. So the staff recommended action for consideration today is long. It has 3 resolutions. First, to eliminate Health Express service, then to eliminate the MyRides program, then to establish the new Placer Rides program, to adopt the Placer Rides service policies, and to adopt amendment number 2 to the CTSA budget. Amendment number 2 to the CTSA budget adds a new line item for Placer Rides, reallocates some of Seniors First time from currently their Health Express program management into Placer Rides, sort of right-sizing the budget for the expenses that we're going to have over the next couple of months should the board choose to move forward with the service change. At this point, I'd be happy to take any board questions, and then it is a public hearing, so we will want to open it up for public comment.
All right, thank you very much. It was a very thorough presentation. It's much appreciated. Any questions or comments from the board?
I do have a few.
Yeah.
Anyone else? Okay, so Kathleen, thank you for the presentation. Just a couple of questions. So new or infrequent users, those who would have been utilizing the prior program, should we move forward, What is the means for communicating to them? In the past, people were accustomed to the prior programs. They're going to go to those sources. In some cases, Seniors First, that's easy. They'll be able to redirect them. But on the other hand, what means will be available to assist so that people are directed in the right way? So that, I mean, this is a group that needs support, clearly. So how do we accomplish that?
Sure. So I'll explain it differently, sort of for the Health Express folks and the MyRides folks. So currently Health Express has about 500 registered passengers. However, due to limitations, only about 40 people currently use the service. So I do have a address, email, phone number list for all those 500 folks. They receive the notice for today and they'll receive another notice next month. So should the board choose to move forward, explains the process, sends them an application form, gives them my contact information, gives them Seniors First contact information so that they can reach out. The issue is, of course, going to be that of the 460 folks who don't currently use Health Express service, probably some of that information will be outdated. So starting next month, I'll be giving presentations to Placer Independent Resource Center, Older Adult Advisory Council, the Adult and Disabled Resource Center, all of the sort of nonprofit folks who engage in other aspects, and getting them up to speed about the existence of this program, who to talk to, and where the information is, so that hopefully we can get folks who may not have received other information from Health Express informed. On the MyRide side, anyone who's currently, because of the structure of the current program, anyone who's currently using MyRides has to call Seniors First every time they want to take a trip anyway. So if they're an active user of MyRides, Seniors First staff already talks to them all the time. So beginning next month, they'll start informing those folks. They already know, but we'll really start letting them know June 30th will be the last day of MyRides. You need to get your application in. We'll be able to track who sent in their applications and make sure that all that information is up to date. In addition, the South Placer call center staff are all going to be updated. So folks who make calls for a dial-a-ride, those drivers on our other services will all be made aware of this program change. So hopefully folks will come into contact with one of these individuals related to transportation to be able to get more information about the service change. After the fall, I'd like to do some general marketing and advertising to get the word out, to try to expand the program and get more people who maybe weren't even aware of the previous two programs to be able to get on board and use the new program. But I'd like a couple months to let Seniors First staff and myself get adjusted to the new program with our existing riders before we start trying to expand.
Great, thank you. So the eligibility. So you put the slide up with the eligibility. So when you look at Health Express MyRides, is there any huge variances? And I apologize if you explained that. I was trying to listen for that to see if, and there wasn't a line to say, okay, here's what's available and not available. Are there any significant gaps?
No, it's additional eligibility. So more people will be able to use the new program than the previous two programs. Previously, it was just seniors and individuals with disabilities. 60 plus was the age requirement for seniors. So that eligibility has remained consistent, but we're adding on low income individuals into the program because sometimes there are folks who are, say, 58 who have a need, or families with young children who have a need. We want to be able to accommodate it if we can.
And so it's not a and, it's an or.
Or correct.
Okay, perfect. Thank you. That helps. Let's see here. Is there any example of this type of a program where the individuals are seeking or finding their own drivers that we are able to reference that you've used as kind of a model? And then how successful has that been? And then adding to that, do they have any methods, whether it's an outside group that provides lists? I know we do not want to get into the practice, even at an arm's length, of saying, here's drivers, because that creates a scenario where there's some ownership, right? Some liability. So again, do we have an example of where that works, how it's functioning? And then secondarily, are there groups that help provide lists? So individuals, trying to go out and find a driver, Brian drove up here, but I couldn't get a ride with him today. So
You just had to call.
but knowing who and finding that. So
Sure. So the partnership with the nonprofit in Riverside Independent Living Partnership, they've been successfully running this program for about 30 years. They do about 2 million-ish trips a year. So it's they're a big county. So it's a big program for them. And then they have helped 15 other counties in California and across the country implement this program. I'm happy to provide links to the board to be able to look at the examples in other counties, rural, suburban, urban. Boston uses a similar program. A lot of times, like we're going to use it here in Placer, it's just supplemental. So you have dial-a-ride, you have fixed route, you have the train, but sometimes you just need these trips that are hard to provide another way. And this provides an ability for us to pay for those.
Okay.
Okay.
Thank you. And I think it would be helpful, especially if we have similar communities, counties that have implemented a program, and I don't know about the rest of the board, just to have an opportunity to look and see what they're doing, just to have a sense for that. Okay.
Absolutely.
All right. Thank you.
Bruce?
Yeah, a couple of questions. And it's along the lines of Mr. Broadway's. So are there patient advocates or rider advocates that can help folks navigate the system?
Yes, I knew there was a part of Mr. Broadway's question I didn't get to. So to clarify, we don't want to determine driver eligibility and booking the trips for the liability purposes, but we still definitely want to be in the business of helping folks find drivers. So the Riverside example, they have developed a bunch of sheets that helps folks think through people in their life who may be able to provide these trips for them, brainstorm. And then most folks will be able to provide these trips on their own, but Seniors First staff, because they're not doing all the paperwork and the matching, Seniors First staff will be able to dedicate time to getting on the phone with folks and saying, hey, let me help talk you through trying to identify someone in your own network and try to find someone to be a volunteer. In addition, we have current My Rides drivers who have been volunteering for the program, many of whom for decades, and do really a wonderful job for the Placer County community. And so we'll be having a volunteer driver registry kept over at Seniors First of folks who call and say, hey, I'd like to be a driver, but I don't know anyone who needs a trip. And then in the case where someone can't find a rider, then Seniors First staff will be able to say, here's a list of folks by maybe rough geography, here's our contact information. You reach out, you plan the trip, you try to engage with the driver.
And then you mentioned, and I forget which program it was, but the hospital systems are part of this, right? Or the care community, right?
Yes, so currently the hospital systems help fund the existing Health Express and My Rides programs. Due to the dramatic cost difference, Ctsa will be able to carry it by ourselves for the first year, but we definitely are going to remain engaged through Seniors First with the hospital systems to be able to continue to help this partnership and make sure the folks in the hospital who are dealing with discharge or patient issues in general in the hospital system are aware of this program.
Yeah, I think what I'm driving at is multiple channels of communication are always lead to greater success. Can you put up your slide that was the services slide?
This one?
I'm not.
Oh,
No, the one all the way service policies.
service policies. Okay. Riders.
No, keep going. Yeah. Well, I'll just articulate my question. It said the payment is made to the rider. How does a driver ensure he gets paid?
Sure. So this is the fraud question. I've, of course, had many of these questions for the existing programs and did my diligence to talk with folks. By far and above, they don't have issues of fraud where, for example, what board member Howshell is suggesting that the rider gets the payment in the rider's name. What's to guarantee that they transfer it on to the driver? If they, because of the eligibility requirements of them needing to identify transportation, the sense is that they need a trip. They don't have another way to get a trip. Therefore, they would be asking for a trip from a person who they might not normally be able to ask for a trip, and that compensation would be sort of required to make that partnership possible with the driver. We're going to very closely monitor, particularly over the first year, reimbursement requests that are coming in. If they're coming in at, say, exactly 200 miles every month, or if there's trip purposes that seem suspicious, or a driver that's being referenced by many riders who seem to be getting that information back, we're going to monitor it on a case-by-case basis. But in general, this is definitely one of the downsides of us being less involved in the matching of riders and drivers. There is a certain amount of risk. However, the low cost 50 cents a mile sort of limits an individual's ability to take advantage of the system. And the staff recommendation is that the possible benefit of the ability to scale this program outweighs the potential risk.
Sure, and maybe this isn't our issue because this isn't not our program, right? But I asked Ken for a ride. Hey, Ken, you give me a ride, right? I'll get reimbursed. I'll pay it. Ken gives me a ride. He goes through the expense. Ken can't find me. I can't, right? So that's what I was just driving at is,
It's certainly possible, yes. And it is one of the things that we are going to be very hyper aware of initially. And of course, the folks we have existing, our initial ridership is likely to just be Health Express and My Rides passengers. So those folks are already utilizing our public transportation and non-emergency medical transportation program. So in general, there are earnest individuals who have a real need that we're able to provide an economic basis. As we continue to grow and scale, we're certainly going to be on the lookout for those types of issues.
Any other questions or comments from board members? Seeing none, I do have one quick one and
Please.
one that may build on Bruce's concern. So I'll build on Bruce's concern first. Any thought about maybe needing dual signatures on the reimbursement so that the driver has to see that check and sign off on it in order for payment to be made?
Sure. I should have mentioned that when before a rider when they identify a new driver to their network, that person has to sign a waiver and submit it to seniors first. Once they've signed one time, they don't have to sign every month for the reimbursement, but that's something certainly something we could look into. My goal is to try for these folks who are already struggling so much in a system to try to limit the amount of paperwork as possible. But yeah, so we at least have that one check where they had to have a driver assigned to be part of their network in order to be a reimbursable driver.
Okay. And then I believe I heard you say, and this word popped out for me, given that this is a non-emergency medical transportation service, you, I believe, used the word corrections.
Mm-hmm.
So could you flesh that out for me?
Sure. So I would categorize our existing programs as non-emergency medical transportation programs. I would categorize Plaza Rides as a transportation assistance program. So currently, even though we call those programs non-emergency medical transportation programs, we do allow for trips that aren't necessarily directly medical if the argument can be made that the overall mental, physical health of the individual is at stake by the appointment. In adding sort of correctional or rehabilitation appointments as an eligible trip, folks who say have to have a parole appointment or go to court or deal with some sort of public service that they're required to do, this would be an eligible trip type for them, given that they already met the pre-eligibility of the program, registered, did the paperwork, signed the waivers, that this would be an eligible trip type should they need it.
All right, that's what I thought I was hearing. And what I've heard, don't know that it's true. Perhaps Mr. Holmes can verify this for me. What I've heard is that one of the issues of homelessness surrounding county facilities is that some of these folks don't have transportation to be able to get to probationary meetings, that type of thing. And so they camp out right there. So a program like this might allow them to range a little farther and be able to make those meetings. So it's a good idea.
Well, generally, the probation department knows who these folks are and they go to them as well as
Okay.
Health and Human Services for those kind of services. So they're out there all the time. Actually, we just increased their budget by $667,000 to allow more deputies and more Health and Human Services folks in the evenings go out after 5 o'clock and check on these folks. So probation generally goes, they know who those folks are. So does the sheriff's department there. If you ever did a ride around with them, you'd be amazed about they know who's who and who's not supposed to be there, if they're supposed to be in court, etc. And so I feel pretty comfortable the way it's working.
All right. Actually, I wouldn't mind doing that right along. You can arrange that for me, right?
Oh, yeah.
Yeah, good. All right. Very good. I have nothing further from the board. So with that, I'll go ahead and open up the public hearing. Anyone wishing to testify on this item? Let us know now, please.
Chair Joyner, we do have two individuals requesting to speak, so I'm going to unmute them at this point in time. Jim and Marty, I have unmuted you, so go ahead and do so also on your device, and then you can feel free to introduce yourself and speak. You have 3 minutes.
My name is Martha Dill, excuse me, and I live in Forest Hill, California. I have been driving for Seniors First since 2008. I have had mostly good experiences. I've always appreciated the driver coordinators and the work that they do. The reason why I started to drive was that because I live in Forest Hill and there's no public transportation up here, is I hope that when my husband and I need a car and a driver, there will be one. I have a couple issues with the new plan. I do like that there's more availability for arranging your own rides. I do not want to become a bill collector. And I don't like the fact that I will not have any control over my miles being reported and reimbursement being paid directly to me. That makes me nervous about driving people who I've never met before. And also, I understand that the liability is now all mine, where originally, of course, it started with me, but then Seniors First had additional liability. Those are my main concerns. And then, of course, we deal with people who do not have the best memories. And we deal with people who are sometimes unpleasant. And perhaps they've thought I'm unpleasant and decide that they're not going to reimburse me for my miles. I also want to know who's going to be keeping track of the hours and if that is still part of this, because it is a volunteer thing and hours should be important. When I leave my home right now, that's when the mileage starts. And when I pull back onto my driveway, that's when it ends. Am I going to be guesstimating what it'll be? And I made notes and I think that that's about, oh, and I also do not want my name and number on a public list at all. If there is someone who needs a ride, and if the coordinator wants to call me and ask me if I want to do it, that's fine. But unless I know people, I do not want them calling me at all. And that's it.
All right, thank you, Martha. Anyone else wishing to testify on this matter?
Mr. Chair, we do have two others.
All right.
Michael Garabedian, I have unmuted you, so please do so on your device as well. One more time, Michael.
Good morning, PCTPA board members. This is Mike Garabedian, Placer County tomorrow. A brief note about one of the problems we have with transportation to Sutter, the growing problem. I think it's important to know note how we got there. I don't want to take long on this, but of course, in that case, a developer offered Sutter the land, and they took it in spite of the fact that being by our major intersection, which no project can relieve the congestion because of the 100,000 units coming along and the other transportation issues. So it's a particularly unwise process that I think PCTPA should be aware of when land is offered by developers to universities or whatever that are going to be in congestion territory. And this is a problem for people seeking medical help as well. We have no objection to the proposed program. Thank you.
Thank you, Mr. Garabedian. We have one more.
Will Tift, I have unmuted you. Go ahead and do so on your device as well.
Good morning. Can you hear me?
We can.
Great. Yeah, my name is Will Tift. I'm the Assistant Director with Area 4 Agency on Aging. We provide financial support for transportation to seniors first. We are currently in an RFP process where $44,000 is available for transportation services to older adults in Western Placer County. We have just recently been made aware of this plan to change service. This particular service model, as I understand it, is not compatible with the rules and regulations of Older Americans Act funding. We require drivers carry insurance. We require that our funded partner, in this case Seniors First, verify that they have insurance. We require that Seniors First itself carry insurance on its volunteers. I do not know what legal precedent staff is citing when they say that having an individual sign a waiver frees the Ctsa from liability in the event of an accident. I would think that the individual or the family member would not be prohibited from filing a lawsuit. If the only reason that this ride with this stranger or acquaintance was happening was because the transit agency had provided a financial incentive for that ride to occur, I do not know how that would shelter the county and the transit agency from liability, civil or otherwise. I'm not sure how such a program would be audited, how you would verify that the rides occurred at all, how you would verify how many miles those rides were, how you would verify, as was already questioned, whether those dollars were in fact provided to the driver. You made reference to the Riverside program, Independent Living Partnership, which I assume is the Independent Living Center for Riverside County. I do not know if they are affiliated with the Office on Aging, our counterpart, Agency on Aging in Riverside County, which also has dedicated dollars for transportation for older Americans. I would be very interested to know if Riverside Agency on Aging is providing financial support to this same service model, or if they are running a parallel program for older adults. The service model does occur to me to be more favorable for younger adults than older adults. I don't know what percentage of the ridership that the numbers that were presented here this morning are older adults versus folks with disabilities or other populations. The reason older adults struggle with public transit and also with dial-a-ride is that the nature of their trips are not routine and they are not predictable. And so often what an older adult really needs is for you not just to take them to the doctor appointment, but to sit there and wait for them because they don't know when they're going to be done. And they don't want to have to sit, wait for some driver to come back and get them when they are done. They may not have a cell phone to be able to place that call when they're done. We have a lot of concerns about this particular program. Obviously, we want to continue to support transportation for frail, vulnerable folks who aren't able to use other transit options, aren't trustful enough to use Uber, Lyft, or don't have the cell phone, the technology to be able to access a program like that. My question would be, why is it necessary to end the My Rights program in order to start and publicize and ramp up a new program? Could they not run parallel? Thank you.
Thank you, Mr. Chair. Anyone else wishing to testify in this public hearing?
Mr. Chair, I'm not seeing any other hands raised.
All right, and with that, I will close the public hearing. I'm not sure if it's standard, if staff wishes to address any of the statements that were made, you're free to do so.
Sure, there's a couple of things, and Mr. Tift, I've been working through Seniors First on this issue. I was unaware of the liability issue with the funding from Area 4. My understanding was that the issue with the funding was mostly related to making sure it only went to seniors. So the addition of low-income individuals, we had to make sure we could keep the pot separate. But I'd certainly like to follow up with you to see how we could work together in the future. In responding to the why can't we add Placer rides in addition to My Rides, as I presented earlier in the presentation, My Rides ridership is down really dramatically, and we're having a lot of issues securing volunteers, particularly in our unincorporated area. So the goal, in addition to meeting some of the budgetary concerns with Ctsa, is to try out a new program and to see if this can meet the existing needs of the My Rides program, and in addition, add on those folks who we haven't been able to serve with either of our programs in the future. Of course, it's different and the rules are different, and there's definitely going to be growing pains as we sort this out. But it's a finite number of folks who are using the existing program, and Seniors First staff are wonderful network builders and connectors to be able to work on a case-by-case basis and make sure we're getting to all those individuals. So.
Okay. So then I guess the question I would ask, has staff heard anything in the testimony that would give you pause in proceeding today? Do you want us to go ahead? Yes. All right.
Chair Joyner.
Yes.
So we do have another board of directors who has raised their hand, Sandy Amara.
Right, Sandy, go ahead. Sorry, I didn't see you.
That's no problem. Thank you very much. Yeah, I just was wondering if staff could answer. I don't know if there's legal on listening in. I do. I think it causes me some pause with regard to the liability. I kind of agree with that we, I'd like to hear from legal in terms of, or someone in terms of how, you know, in my experience, signing a waiver doesn't really protect us from liability. So I would be interested to hear someone speak to that.
Chair, we have our legal counsel, Deanne Gillick, on the Zoom.
Right, Deanne, go ahead.
Hi, Deanne Gillick, General Counsel. A couple things. One, I know staff has done a very thorough job putting the program together. And I know the comments from the representative from the state will be, evaluated critically to make sure that that the program is aligned with our funding sources and the requirements, the state requirements. I have not in detail evaluated the documents and the forms and the procedures. Commissioner is correct in that an agency or an entity or an individual could always be sued by someone. So a lawsuit or, a challenge could always occur. The question is whether or not the agency would be protected from liability and an ultimate outcome from the lawsuit. And it is possible to waive or to pass that liability on to someone else. As I said, you can always be sued, but you can successfully pass that on, that waiver. The question would be whether or not the person or the entity you're passing it on has adequate means to provide the backstop. And that sometimes is the question or the concern that you passed on the agency liability, but the person or entity you passed it on to has inadequate insurance or inadequate assets to cover any situation. So it's not without having previously reviewed the details of the program and the waivers. It's not that it can't occur, but at the same time, it's not that it's without risk. So it's certainly something that we could evaluate in implementing the program to make sure that all of the precautions are taken so that the entity is protected to the maximum extent that it can be. So I know that that's not a specific response, but without knowing the specific, details of exactly what the waivers are and who it's passing on to, that's some general principles and things. So I could answer any follow-ups to the extent that I can. Yeah.
Sandy, does that cover what you were concerned about?
Thank you very much. Yes, thank you.
All right. Trinity, I see your hand raised as well.
Yes, thank you. So the question, I kind of have two parts here. First of all, the answer to the question about the liability to me makes me very hesitant to proceed with the dissolution of the existing programs before those answers are fleshed out a little better at this time. But I did want to kind of circle back to the privacy and the essentially the financial security concerns brought up by one of the drivers earlier during the public testimony. I apologize, I couldn't jot down your name in time. But I was hoping that Kathleen, I'm hoping staff could address some of those privacy concerns and the financial security concerns, because I think that is a very valid question. I personally could understand not wanting my name to be on a public list available for just anybody, and, being concerned that perhaps even the person I'm working with may forget to make sure that I receive payment, situations like that. And I'm hoping staff has some more information there.
Sure. So I can clarify on the volunteer registry. That is not going to be a conversion of our existing MyReg drivers to a registry. It will not be publicly available. The existence of that would be if an individual contacted Seniors First and said, I would like to be contacted by folks who need trips. I've heard about this program. I would like to be a volunteer. Please have my contact information available to folks who are interested in contacting me. So it would very much be an opt-in basis. And even so, to receive that information, the individual would have to, the rider would have to contact Seniors First and ask for a list of available drivers to help with volunteers. So wouldn't be, say, posted on a website or really publicly available in the general sense. On the issue of the payment passing through, because the idea is that because the rider is selecting a driver who they know and that those two individuals have a relationship outside of the reimbursement of the mile, that there would be a level of trust between those two individuals to make this system work because they aren't strangers being provided to each other. I think in the case when Seniors First staff would be arranging for strangers, for lack of a better term, from the volunteer registry with the drivers, to that we staff could put systems in place, for example, that the first month that the rider is, that they are able to contact and say, hey, I never received payment, and this is the number of miles that I'm saying that I did, and that we would be willing to work through to make sure that the rider received payment for those miles on those cases. But it would be a pretty rare case by my estimation. And then to respond to the liability issue, I definitely appreciate Deanne's comments. So the reason that Deanne has not reviewed the specific liability waivers today is because waiting for board direction to move forward with the new program. As a reminder, the old programs won't end until June 30th. So they don't end today. So folks will continue to be served over the next number of months by our existing programs while we have legal review. Of course, they'll be working off of the existing programs that work in other places, the forms they use, but they would all be reviewed and confirmed by our counsel to absolutely, staff intent is to protect us from liability on this issue, and that those will be developed over time. I think board, if there continues to be board hesitation on doing these two things together, my goal in putting them together was to provide clarity to the public, but given that we have time until the end of June, we could certainly, an option the board can consider is to move forward with the actions of starting the new program today and then come back to a further meeting to make the decision on ending the program. it just gives folks less time who are on the existing programs to between when they find out their program's ending and when the actual last day of service is. So.
So Kathleen, to follow up on that, again, 2 questions. One, so in this new program, there would be no intermediary. So if a person, you know, like our speaker who would prefer not to have their number provided to strangers, there would not be that third-party volunteer person who would be that go-between, that would not exist, correct?
That's correct.
Okay, so that I can understand how a person would be uncomfortable with. But second of all, is there, you know, let's just say the board was to make the decision to move forward with starting the new program and come back to maybe the next meeting to consider dissolving the other 2 programs. Would it be possible for us to still at least do the outreach campaign to get the word out that this is something that's coming, so that, you know, at least we're not we're trying to do our due diligence without putting people in a hardship?
I think it's certainly possible that we could increase public understanding of the option of the program to end. The issue is, of course, because the public has every right to come and make their case before you and convince you to make a different decision. We, as public agency staff, don't like to communicate that a change is definitely happening until we've received board direction that the change is happening. So it's a little difficult for me to be frank with members of the public that you should act as though this is definitely going to happen when it's not the case until the board has made the decision.
That makes sense. Okay, thank you.
That's it, Trinity?
Yes, that answers my questions. Thank you.
Thank you. Mr. Baker.
I see this program as friends helping friends. And so I think it's going to be a rare occasion where we have kind of non-linked up people. Even with the friends helping friends, the payment and the mileage verification do concern me. And it might be a simple way to fix that with just using, I mean, there's a ton of different apps, mileage tracker apps or different things. And at the end of the ride, the person sends an email to an email box that says, hey, I just took Mary, and this was the date, and here's the log of what we did. And then if 3 weeks later, Mary doesn't say, hey, I had a ride and this is what the mileage was, you know, there's a way for somebody to say, hey, Mary, did you go for a ride? Oh yeah, I did. And then it kind of helps out, just because as we age, we can be a little bit more forgetful. And so it's just another way. I know it would be additional work for staff, but it would be a way for kind of that verification and just to help kind of put people at ease.
Absolutely. I think based on board direction, I'm definitely going to amend my idea of what the monthly reimbursement form requests to have some sort of both driver and rider consent on the origin and destination and total number of miles that are happening. I think that's a great suggestion. The smartphone app's a little tricky because, of course, the individuals who are using the service and most of the individuals who are providing the volunteer service are not in much of the overlap with our technological crowd. So some of those problems tend to result from that. But I think something that has the driver and the rider agreeing upon what took place and how many miles there were makes a lot of sense.
All right. Anything else from the board?
Yes, Mr. Chairman.
Bruce?
Remind me of the outreach you did as you developed this process again, because we had a representative from the aging area 4 on aging. Remind me.
Sure. So far, the bulk of the outreach has been with the transit operators working group in the initial solving of the budget solution. Once we identified this as the potential solution moving forward, we worked closely with Seniors First staff and the members of our Social Services Transportation Advisory Council, which are sort of our nonprofit riders, more higher need individuals for social services who met and discussed this issue in January at their meeting on the idea of the solution. On the details, the logistics in terms of determining the form, figuring out who would sign where, what would the maximum cap would be, that's been mostly with Seniors First staff who work with the riders and really understand what their needs are in terms of use. In terms of public notice for today's meeting and what the service change would be, all of the individuals who are registered for Health Express or My Ride service received the notice with the information and the link to today's meeting. And then in addition, an ad ran in the Auburn Journal to provide more information to folks about the service change in today's public hearing. All of those are consistent with CTSA's public participation plan.
And one last question. Oh, no, I just answered my own question by reading the resolution. Okay.
All right, thanks, Bruce. Anyone else? If not, chair is open to a motion. Can we handle all 5 at once? Anyone wishing to make a motion on this item?
Yeah, Mr. Chair, I feel comfortable with making the decision to move forward. Certainly, Kathleen knows her stuff. There's no doubt about that. I'm sure you've done a lot of outreach and you'll still do more. And knowing that our council is going to make sure that the liability issue is resolved before we move forward, I don't have any problem making the motion. And I will make a motion to adopt resolution number 21-13 to eliminate the Health Express program, adopt resolution number 21-14 to eliminate the My Rides program, adopt a resolution number 2115 to establish the Placer Rides program, adopt the Placer Rides service policies as presented in the staff report, and adopt fiscal year 2020-2021 budget amendment number 2 as presented in the staff report.
All right, I have a motion
Broadway will second.
and a second. Sylvia, roll call, please.
Amara,
So do we, I guess my question is, do we, if there, I mean, or do we take all these as one?
We can take them all as one, yes.
That was the
Yes.
motion in this case.
Yes.
Okay, no,
Baker,
Aye.
Broadway,
Yes.
Burris,
No.
Holmes, Howdeshelt,
Aye.
Joyner,
Aye.
Jones,
Aye.
Wilkins,
Yes.
motion passes 7-2.
All right. That was a very good discussion. I much appreciate it from all of you. And you'll stay on top of it, make any adjustments that seem appropriate and report back to us.
Absolutely. So in June, I'll have another budget item for next fiscal year for the CTSA budget. So I'll certainly report back out and any relevant actions the board may need to take the direction I received today. I really appreciate it.
Very good. Thank you. Good work. With that, we move on to item J, CRRSAA Highway Funding Allocation and RTIP Amendment. Ms. Hanley,
Thank you, Mr. Chair.
do you need a break, a drink of water, anything?
Brought my cup. I knew it was going to be a lot of chatting today.
All right.
So today for board consideration is 2 discretionary funding sources, the Coronavirus Relief and Response Supplemental Appropriations Act, or CRRSA, and the Highway Improvement Program, or HIP allocation. So the federal government, through one of its relief acts as a part of the coronavirus bill, provided discretionary funding to do economic stimulus by funding transportation projects, highway infrastructure projects through the CRRSA program. And the highway infrastructure program is a part of the federal infrastructure bill, the existing FAST Act bill, where we get ranging amounts of discretionary funding most years to apply at PCTPA's discretion. So today for board consideration is the staff recommendation that both of these funding sources, including $3.2 million of CRRSA and just under $300,000 of HIP, be applied to the Interstate 80 Auxiliary Lanes project. The Interstate 80 Auxiliary Lanes project is a partnership between PCTPA, Caltrans, Federal Highways, Rockland, and Roseville to add a 5th lane on westbound I-80 between Douglas and Riverside, and an auxiliary lane between the 65 interchange and Rockland Road on eastbound Interstate 80. This program, this project, as it has finished final design, has seen some cost increases, mostly associated with rising costs for construction materials and bids are coming in for similar projects. So with updated cost estimates, there is a funding gap on this project. As a reminder, this project received Senate Bill 1 funding through last cycle in the Solutions for Congested Corridors program and the Trade Corridors Enhancement Program. Those state funds are competitive, and it's the responsibility of the local agencies to secure any funding cost increases. So staff recommendation is to apply these discretionary funds to this project. So to fill some of that funding gap and to continue to ensure that our Senate Bill 1, our more than $25 million in Senate Bill 1 funds that we received last cycle remain safe and remain on this project. So continue to move forward with congestion and fix those bottlenecks on I-80. And with that, I'm happy to take any questions.
Questions from the board?
Yes, I
Mr.
have
Broadway.
one, Mr. Chair. So the $3.5 million deficit that still exists between the original 30, what did we have? 31.9 million and the 38.4. Do we foresee any challenges finding that funding?
Staff has identified a couple of solutions to finding those fundings, including future discretionary funds that may come through with additional stimulus for the federal government, as well as some existing pots. But we want time to work with the local jurisdictions and the public works departments to really identify a bottoms-up approach to filling that funding hole. So we're starting with these funds that everyone has already agreed upon should go towards this project, since they're one-time and discretionary in nature. And we'll come back in the future for additional board direction to fill the rest of the funding gap.
Okay, and that existing gap does not put us at risk of the funding that's been made available from the state being rescinded?
The existence of the funding gap does not put us at risk. Should we not be able to secure the funds, which staff doesn't anticipate, over the project is not supposed to go to construction for a couple more years. So we have time to sort that out. And then even through some programming processes during the time of construction, we can continue to secure those funds. It's only should we choose to not fill the funding gap, and we'd have to give back the funds. So as long as board direction is to continue to bring this project to construction and get it fully funded, then those funds are secure.
Okay, great. Thank you.
Any other members of the board, questions or comments? Seeing none.
Chair Joyner, there is one comment from participants in the public.
From not
You
from a
have a-
board member. I was just about to open it up to the public. So I'll go ahead and open it up to the public now. Anyone wishing to comment on this item?
We do have one commenter. That is Michael Garabedian. Please unmute yourself.
Thank you. Mike Garabedian, Placer County tomorrow. All three of these allocations are necessary for safety reasons and have no concern about the language supporting the freight project. But note, I think it's going to be something we'll be noting on and on, that this is stated to be for relieving congestion. And I know it's part of that program, but any thought that this congestion in that area is going to be relieved, I think is a fantasy. Nonetheless, support these projects for the safety reasons. Thank you.
Thank you, Mr. Garabedian. Anyone else from the public wishing to comment?
There are no other members of the public wishing to comment.
All right, we'll bring it back up here to the board for action. Anyone wishing to make a motion?
I'll move to allocate. How do you want me to read this motion?
Krista.
Carissa, that's a Allman Brothers song. Right? Oh, that's Melissa. I make a motion to allocate Carissa Highway funding and RTP and the RTP amendment and adopt a resolution 21-16 nominating the Capital Region Freight for the I-80 project to the CTC for STP, STIP.
Broadway will second the motion.
All right, does the motion get it done? All right,
Amara,
Yes.
Baker,
Aye.
Broadway,
Yes.
Burris,
Aye.
Holmes, Howdeshelt,
Aye.
Joyner,
aye.
Jones,
Aye.
Wilkins.
Yes.
Motion passes unanimously.
Thank you. Moving on to item K, fiscal year 2021 overall work plan and budget amendment number 2, Mr. Lucan.
Thank you, Mr. Chair and members of the Board of Directors. The item before you this morning, as is a regular occurrence with our board, every year, it's the time of year that we bring potential amendments to our overall work plan forward to the board for consideration. And so this year we are doing this at the April meeting, and the changes that you see in the OWP this time around relate to a few basic things, although they have a ripple effect and you see a large changes throughout the document. The two biggest changes were changes to our revenue. As you know, the board adjusted our LTF revenue at the last board meeting. We had an opportunity to, because sales tax revenue came in better than expected, to add additional funding to our budget. We moved that into some of our programs as well as our contingency funds. We also have a significant vacancy in our staff with our deputy executive director position. And so we had to reallocate hours from that position that was originally assigned to some of our projects. And thus taking that out of it required a comprehensive look at our budget. And then the last thing was to adjust our funding strategy. We were constantly looking at things and the appropriateness of those things. We're able to take a couple of those items out and push them to the future. And so those three things had a ripple effect on the entire OWP. And thus you see really a change in almost every work element in the OWP. With that, I would be happy to answer any questions that you have on the document. Staff's recommendation is to move forward with amendment number 2 to the OWP. I would note that although we took the deputy executive director position out for the remainder of this fiscal year, in next year's OWP, which the board has already considered the preliminary draft of that, and it will come back at your next board meeting for final approval. That deputy executive director position is put back in the budget. So it's just temporarily out in this amendment number 2. For that, I'd be happy to answer any questions that you have.
All right. Any questions, comments from the board?
Yeah, thank you, Mr. Chair. Has the agency utilized any line of credit funding in the past? I remember right, we have, but
No, we have not. It is something that public agencies are looking at. Frankly, it makes us a little bit nervous that we have traditionally used our reserve as our line of credit. But I'd hate to be in the point where we would be at a low level of cash and then have some type of emergency situation. And so we're working with Umpqua Bank, our current bank, to see if that's something we want to move forward with. It's I would say at this point, it's highly likely that we'll take a look at that. The cost is very low for that type of financial instrument, and a lot of special districts in California are having that available, just in case. So I think we will probably come back to the board with a recommendation early next year to move forward with that with Umpqua.
we might need to do that, just to get things done.
Yes. Yeah.
Any other members of the board have questions or comments on this item? Seeing none. Mike, if you could, this is not the appropriate time, but perhaps in your executive director's report, just fold in an update on your recruitment for that.
Yes, sir. I plan to do that.
I'd appreciate that. So chair is open to a motion.
Chair Joyner, there is a question from the public.
Oh, I'm sorry. I've been so good about going to the public today and I missed it on the last one. Sorry about that, folks.
Okay.
Go ahead and
Almost a
open it up
perfect
to the
game.
public.
Okay. Michael Garabedian, I'm going to unmute you. So go ahead and do so on your device as well.
Thank you. Mike Garabedian, Placer County tomorrow. Want to note objection to 3 of the work elements, 40, 41, and 42. Placer Parkway. The remaining 8065 interchange improvements had no objection to the phase 1 safety improvements, which were absolutely necessary, but also opposed to the Highway 65 widening. That's it.
All right. Thank you, Mr. Garabedian. Any other members of the public have comments on this item?
There are no other hands raised at this time.
All right. So
sorry. I take that back. There's one hand that just popped up.
All right.
Mr. Kirk Euler, please unmute yourself on your end.
Yeah, hi, Kirk Euler calling on behalf of the Placer Business Alliance. Want to say that the businesses in Placer County fully support the work that is being proposed and wish to see all these projects move forward.
Thank you, Mr. Euler.
Okay, Mr. Chair, that is all the hands that were raised.
Got it. Thank you very much. I believe I had a motion. Did I have a second?
I'll second. Haddle seconds.
All right. Sylvie?
Amara,
Yes.
Baker,
Aye.
Broadway,
Yes.
Burris,
Aye.
Holmes, Howdeshelt,
Aye.
Joyner,
Aye.
Jones,
Aye.
Wilkins.
Yes.
Motion passes unanimously.
Thank you. We move on to item L, traffic congestion report presentation. Mr. Hoyt.
Yes, thank you, Mr. Chair. I'll be doing this remotely here. And so I imagine Jeremy will be pulling up the slides. But we've been doing this presentation on traffic congestion and where we are with traffic as we start to trend back to normal because of the impacts of COVID that it's had on kind of our daily lives, our activities, our travel patterns. And so we've been doing this since I believe at least last October. And this is the continuation of that. The updates I'm going to show today are through the end of March. And it's a monthly roll-up of traffic to date. We compare it back to the beginning of March of 2020 and even look at some numbers from 2019. So if you would go ahead to the next slide. Generally at a very high level, our residential vehicle miles traveled, so basically all the miles that we travel starting off at home is shown on this chart. This chart comes from the data and analytics firm called Replica. And they're estimating travel based on information they receive from cell phones and other data sources. So it's just an estimate, if you will. But before the first stay-at-home order started in March 2020, we were traveling on average about 18 miles per day as a Placer County resident from our residential homes. And that dropped off drastically once we hit that first stay-at-home order instituted by the governor, and it ebbed and flowed throughout the year. And we saw, again, another dramatic decrease once we hit late November, early December with a second stay-at-home order, and that reduced our vehicle miles traveled by about 69%. We've since increased from there, from the low point, up to 35% reduction in March, and then actually in April, looks like those are off. Through March, yes, that's correct. And then we've recently jumped up to about 28% of where we were back in March of 2020. So we are slowly getting back to normal. And really a lot of what hasn't happened yet is a lot of employees returning back to the office. So we anticipate that'll continue to creep up as things change. Next slide, Jeremy. So I'm going to focus next on State Route 65, and then we'll wrap up with Interstate 80. These are probably familiar slides to you if you've listened in for the last few months. But the short answer of this, if you really want the Reader's Digest version, is traffic is back. So looking at March numbers in March 2021 numbers in comparison to March 2020 and even back to 2019, our traffic volumes for the month of March 2021 are higher than they were in 2020. Of course, that's when the first stay-at-home order hit. But if we look at these charts, we're also seeing that we're higher than we were back in 2019. Many of our retail establishments are open. A lot of our kids are either going back to school full-time or are already in school full-time. And a few of the things that are not back full-time is our institutions of higher education, Warren Jessup, Sierra College, and a lot of our employees are still working from home, especially those who would have commuted to downtown Sacramento or to the Bay Area. We can see from the charts on the left-hand side here, it's focusing on State Route 65 in the southbound direction. The charts on the right are focusing in on the northbound direction of 65. But generally, our traffic volumes are high, about 20% higher than what we were last year this time on a daily basis. And you can also start to see what the temporal distribution or time of day distribution is between the southbound and the northbound directions. And we're right back up there. There's not a lot to say besides traffic is back as of the month of March. Speeds are a little bit lower than what they were back in 2020, and even lower in some points that they were in 2019. So we're starting to see everything coming back to normal. Next slide, please. This is just a static image of of an animation that comes from some of Caltrans's data that tries to indicate where the traffic queues are backing up to and how far they extend at certain periods during the day. The images on the right are representative of March 2021, or both during the AM and the PM peak hours. We can see that red line extending further and further north up past sunset. And we can also see the comparison to what we saw back in March of 2020. Obviously, that's when we went into the first stay-at-home order. But if we were to look further back at March of 2019, I think we'd see some similarities here. But next slide. Interstate 80 is the last few slides we'll wrap up here. Again, we're seeing dramatic increases in traffic for the month of March on Interstate 80 near the Placer and Sacramento County line. We can see from the charts on the left-hand side, we're looking at the westbound direction of I-80. And then on the right side of your chart is the eastbound I-80. For westbound I-80, our traffic volumes are definitely higher than they were in 2020. And during the PM peak hour, we are seeing the same level of traffic there, which is relatively interesting since there's a lot of people that aren't back to work. This could be more interstate travel that's occurring, or it could be just maybe more flexibility in jobs with people going to different places. But where we see traffic has not returned is that AM peak hour. It's that first increase there on your left, where we're not back to where we were in 2019. Traffic speeds are a little bit higher because there's still a little bit less congestion than what we saw back in 2019. And the same thing goes for the eastbound direction. Next slide. And this is, I believe, the last slide here. We'll focus on Interstate 80 in between the State Route 65 and the Rockland Road interchange. Very similar story here. As I've been saying, traffic is back. We look at I-80 westbound on the left side of your screen. We can see that the blue line, those volumes are significantly higher than they were back in even 2019 during the midday and early afternoon hours. You can see, though, that we have not eclipsed the AM peak hour traffic shown by the gray bar there and on your left side of the screen. If you look over to the right, eastbound I-80, we have not quite hit that level of traffic where we were back in 2019, really throughout the day there. So there are some differences in traffic patterns that have happened because of this. And maybe it's the individuals who work in maybe the 65 corridor who aren't driving there at this point in time. That could just be one assumption, but there may be many others. So I believe this was the last slide. Glad to be able to continue to provide this information on how traffic is doing in Placer County. For all purposes at this point in time, based on March data, it looks like our highways are back at what they were pre-COVID levels. I know that traffic patterns will still continue to change as we continue to move throughout this process. So I'd be glad to take any questions you may have.
All right, thank you, Aaron. Any members of the board have questions or comments for Aaron?
Mr. Chairman, one of the things that we're going to be hoping to do next month is to bring data from at least one of our member agencies, the City of Roseville, in terms of traffic volumes on city streets, at least at this point. The City of Roseville is reporting to us that their volumes on city streets are about 75 to 90% normal, or pre-pandemic levels. So we'll bring that data to you at the next month's meeting likely. So.
Okay, thank you. Doesn't look like there are any questions from the board. So Aaron, I'm curious, I know I've asked this question before, given that some of the data that you're reporting is derived from cell phones, do we have any sense of where folks are going? You say the universities are not open, the schools are not open, the restaurants are open partially, malls open partially. Where are folks traveling right now?
So that is a really good question, Chair Joyner and board. I'm sure that we're all wondering where are people going during the afternoon. Although I don't have that answer for you right now, we have entered into a subscription service for some additional big data, if you will. And we are just now starting to kind of unveil that and understand how it works and to be able to actually do some analyses. So some of the early analyses I've been able to do is kind of by city kind of where traffic's going. in a pre-COVID situation, and now I'm going to start to look at analyses of where they might be going recently. So I anticipate being able to bring more information back to the PCTPA board on this. I know that we will be getting into more details on travel patterns with the Sparta Board of Directors as it relates to the regional impact fee and model update. But great question, and I hope to be able to bring some actual answers back to you in the coming months.
Very good. Thank you, Aaron.
Mr. Chairman,
Yes. Bruce.
your question made me think of a question. So, Aaron, when you do the slides, you do a comparison of 1 year ago. Right, and if you could throw up, and I noticed one of them said a 10% increase. But what is it compared to 2019, right? Because you're comparing 1 year ago, and 10% doesn't sound like it's significant, but I mean, that 10% or whatever increase over a year ago doesn't seem to align with your lines, right?
Yeah, so we are looking at, if we were to go back to one of those slides that show traffic on the map itself, it's showing kind of the change. So if you're looking in the middle of the map here, where it shows the arrows for Interstate 80, our traffic there is showing that on a daily basis, we're higher than 14% higher than we were 1 year ago for the month of March. And then we have the hourly distribution there. So I think probably what you're saying is you would expect, 14% higher across maybe the hourly distribution, but where we see, some peaks and differences there.
Yeah, let me, so if you look to they just took it away. If you look to the lines to the left, right, the westbound hourly traffic volumes for March, boy, it sure seems like, there's a bigger gap between 2021 and 2020. But I think what's informative and instructive for the community, both for our citizens and the business community who use these roads for the movement of goods and services, is look at that, we're above 2019. So it almost feels like we're maybe 10% above 2019 and significantly higher over 2020.
Yeah, Director Hadashel, great comment. What I can do in the coming months, because the data that we will be sharing in the coming months will still be, kind of once that first stay-at-home order was instituted. So maybe it's a good idea, as you're suggesting, to do a comparison of where we were 2021 to 2020, as well as what 2021 looked like in comparison to 2019. And I think that may help address your comment.
This might be covered in the executive director's report, but I noticed in the last week, we've had a number of fatalities in Roseville on 80. So that's troubling. That's a troubling development.
Yeah, one of the things that's come up in some of our workshops is accident data. Some people have been asking about that, and we're going to work with CHP and Caltrans to try to bring some of that data to you at the next meeting as well. So,
all right. Anyone else? This is an information item, but I'll still go ahead and open it up to the public. Any members of the public wishing to comment on the presentation?
Mr. Chair, we do have one member of the public who'd like to speak. Mr. Garabedian, I've unmuted you. Go ahead and do so on your device as well.
I have no need to speak. I submitted my comments in the notes column. Thank you.
All right. Thank you, Mr. Garabedian. Any other members of the public?
I do not see any others at this time.
All right. Then we'll go ahead and move on to item M, the executive director's report.
thank you again, Mr. Chair and members of the board. Very quickly, some items to report on this morning. I kind of touched upon it a little bit, but we are right in the middle, in fact, almost at the midway point for our outreach workshops associated with the funding strategy. We have conducted 6 workshops to date, 2 in Roseville, 3 in the city of Rockland, and 1 in the city of Lincoln. We have workshops still to come, 1 additional in Rockland, 2 in Lincoln, one in Roseville, and then one each in Loomis, Granite Bay, Auburn, North Auburn, Colfax, Tahoe, and Basin, and the Tahoe Basin. These workshops have been, as you know, many of you have participated in those, have been very robust. We've had a number of people come in there and had a lively conversation about traffic priorities and what's important to them, and as well as providing an educational component about how impact fees work, the role of builders and developers in the transportation process and the funding process. And I think overall we are achieving what we originally intended to. We do see somewhat of as we expected, a drop off between the number of people that sign up for these and the number of people that actually show up. But we have a way to address that, because we have a constant feedback with them and outreach to them, not only before the meeting, but after each one of the meetings. We show the people that couldn't make it for whatever reason. We make available to them the video of the Zoom meeting, as well as the PowerPoint presentation, and a short video on funding and how that works here. So we're very happy with the results of that. We always certainly would like to have more people attend these, but we're going to push forward into May and complete these on time. And in terms of our funding strategy, we're preparing for a rather extensive report back to the board in June. And that relates to not only reporting what these workshops are saying, but also we are going to be conducting our first poll around the first part of June. In preparation for that polling, we've convened our board polling subcommittee to take a look at the content of the poll initially, and then we will report back to that subcommittee before the board meeting, and then to the board itself on June 22nd. At which time we will be, based upon the results, making a recommendation to you on as to how to proceed based upon that polling. It really depends what those numbers tell us, but that what we're hopeful of is that will give us a direction. It will also give us direction in terms of geography of what we're going to be looking at. Right now, we're doing a county-wide poll, including the Tahoe Basin, and trying to see if there's interest in the dating back to our effort in 2016 with Measure M, if there's interest on a county-wide basis. So we are taking the board's direction to do that. But we also, again, continue to have the option to, and probably likely, based upon input that we've gotten to date, likely that it will probably be back to a district basis of some sort. But we hold out hope that, a county-wide, there may be some traction for a county-wide measure. But I would say even if we don't achieve that county-wide objective, it's been we expect it will be very worthwhile to talk to the communities that aren't going to be in a proposed sales tax district, because we determine what their needs and desires are for transportation, and we can provide that, or that's useful for not only PCTPA's priorities, but also to feedback to the public works departments and cities and towns in those areas. It's helpful to have that conversation about transportation. Couple other things to report on. We continue to advance our new relationship with Washoe County in the Reno area. We're in pretty regular communication with our counterparts at Washoe County Transportation Commission, as well as through activities up in the Tahoe Basin where we have a mutual interest. And so we are going to continue that relationship and moving forward into the combination of efforts with transportation and economic development, meeting with not only their transportation staff, but the economic development staffs of Northern Nevada, to take a look at what are some common interests between the two counties. And we're very hopeful of this new relationship to to lead to opportunities for working together on projects and especially the funding area. Speaking of funding, we are working on several fronts in terms of the earmark issue or congressionally authorized spending that you may have heard about in transportation news. In terms of Congress, as you may know, Congressman McClintock's office did not participate in the whole earmark area. But we did work with some of our agencies, working with Congressman LaMalfa in the areas of his district to give our member agencies the potential to submit projects to them. We did not submit any priorities of PCTPA to Congressman McClintock because of the narrow area that he represents in Placer County. We are, however, in the next couple weeks, likely to submit something to our two senators, Senator Feinstein's office and Senator Padilla's office. So we're readying some of our shovel-ready projects, if you will, to see if there's a potential for a earmark request through either one of those. And based upon our legislative platform approved by the board in January, staff is going to will submit those requests that are due very quickly in the next couple weeks. And we will report back to the board on the progress of those. One area of great discussion in the county right now is with public transit. We continue, as we reported to the board previously, our efforts on what we term reinventing transit in the eyes of declining ridership over the past 10 years in our local service and the effects of COVID-19 on our transit service. And we're working with our transit providers in terms of developing a micro transit request for interest. We're aiming for summertime to get this out on the street to see what a firm in this arena would be interested in Placer County. And we have some target areas that we're starting to take a look at it with Lincoln, Rockland, and East Roseville, as well as a couple other areas. The city of Auburn, we're happy to report, is moving very rapidly towards microtransit, and their city council now is working with their staff to convert their small transit system to microtransit, probably retaining one of their routes until such time that they know that microtransit, this pilot, is viable. Also happy to report that Placer County, or excuse me, Tahoe area rapid transit, which is a project that works or a service that works very closely with Placer County Transit, is initiating a pilot for microtransit for the summer for the north and west shore of the Lake Tahoe Basin. And so this summer they're going to expand the Mountaineer microtransit service, which is only available right now in Olympic Valley at Squaw Valley, and expand that to the entire north and west shores for a trial basis to take a look and see if this is something that would work in a resort area like the Lake Tahoe Basin in Placer County. We continue to look at our systems. You know, they are in need of a comprehensive relook at least at parts of our existing transit systems, especially with Roseville Transit and Placer County Transit. We're working very closely with our transit providers to see what's appropriate in that arena, and continuing to look for a method to restore confidence in our public transit system. As we've reported when we talk about traffic, part of the reason traffic is likely to return with a vengeance is because our public transit systems are very challenged with a lack of confidence. We still have zero reported contact tracing with COVID-19 in the US to public transit, and in fact, likely to the entire world. But there's just a lack of confidence because of the close proximity that public transit affords people are not trustful of it. And so we have to restore that trust. And then lastly, in the transit arena, we are talking to, we're working with SACOG and our other sister agency, El Dorado County Transportation Commission, to look at a potential webinar to assess major employer return to work, to try to assess, when is the state of California going to come back online with some of their major facilities? When are some of our major employers here in the region going to come back online? Because a lot of what we're doing is predicated on that return to work. So we are working on Kathleen, who is our lead staff person on the action plan, which is the next step, if you will, of the Placer Sacramento Gateway Plan, is working with our project development team to narrow down 12 to 14 projects in the Sacramento region along the I-80 corridor, to narrow those down to a tranche of projects that would be viable for funding in the 2022 rounds of solutions for congested corridors and trade corridor enhancement program and local partnership program, the 3 SB1 programs. So we're again taking this regional approach for applying because we had such success last year. And so we're in that process working with the staffs of 14 or so agencies to determine what projects are ready. And that's a big part of this is there funding in place, matching funding in place for those projects? Are they ready, given completion of engineering, completion of environmental review, permitting, that type of thing, and what is ready for that 2022 push? Lastly, I'm happy to report that we're in the middle of our recruitment process for our deputy executive director position. We have our first interviews for that position on Friday of this week. As well as next week, we're going to be looking at our first interviews for the fiscal administrative officer position, which I've spoken to you all about privately. But our fiscal administrative officer, Sir Shirley LeBlanc, has let us know that she's going to be retiring effective June 30th. And her long term of service has been of great benefit to our agency, and she's going to be very, very hard to replace. And but we had a job flyer out on the street. We got responses, and we're going to be interviewing for that position here very shortly. With that, I'd be happy to answer any questions that you might have on our work plan.
All right, questions from the board? Doesn't look like we have any. Thank you very much, Mike. With that, we move on to board direction to staff. Is there any direction the board wishes to give to staff? I think we did as well. All right. That completes item N. Item O, information items. There is a plethora of information in your packet for your perusal. Our next scheduled meeting is May 26, 2021. And unless there are any objections, we stand adjourned.